Every day is different as a veterinarian. Some good, some calmer than others, some dramatic, and even sad at times. Every patient that goes home with their family or whose suffering I can help is another reminder of why I do what I do. I am DocBott.
Last week on DocBott, DocBott travels to Fort Collins, Colorado to receive his appointment as president of the Society of Theriogenology and spend some much-needed family time at the local museum. And on his way back to his Mountain West Animal Hospital, gets the call that an urgent patient is waiting for him. The day starts quietly at Mountain West Animal Hospital, but things warm up quickly. Rusty's owner thinks he may have a problem with reproduction, and the resident gets briefed on a small dog named Bella with a bad infection on her face.
Beautiful. You guys don't want to get in? You Bella company? Where you close the door, okay? Oh, cool. Okay.
Got a considerable amount of work with the South Utah Valley Animal Shelter, and I had a call yesterday that they had a goat that they found wandering on University Avenue in Provo, and with a very, very full, huge mammary gland. So I went to the animal shelter yesterday and milked her, and she has a very severe case of mastitis. So we gave her some antibiotics and actually did an intramammary mastitis treatment. Hopefully she's on the road to recovery.
Bella's groomers noticed an infection and recommended that her owner take her in to a vet. The resident finds Bella has foxtails or another burr embedded around her eye. Dangerous, as this could cause blindness if they continue to burrow and make it to the eye itself. The burrs are so bad that Bella will have to be sedated in order to remove them.
Okay, so when you're looking at a male dog, there's a few things that we have to be sure of. And the first is that there are both testicles that are in the scrotum in the correct place, and that there are two of them. If there is only one, we call that cryptorchidism, or an undescended testicle. That can be anywhere from the kidney to the scrotum. It can be up here in the inguinal area, but it can also be inside the abdomen. That's a recessive trait in dogs, and so that automatically disqualifies them from breeding. We always highly recommend neutering in those cases. He does have both in place. I just do a very brief examination, look for any anatomical abnormalities. He looks really good to me, so I don't see any issues with that. So for the collection, I use a very special lubrication that's called Theriogel. It's a fertility lubricant. The human equivalent is called Pre-Seed, ironically. It's the very first fertility lubricant, I believe, approved in the United States. So we're going to try to collect semen from him. I exteriorize the penis.
DocBott needs a sample of semen from Rusty to check for sperm number and motility.
Grab onto and collect. Every dog responds differently to this. Some will collect.
Rusty is a good sport and gives it a try.
See if I have the magic toucher on today. He's not happy back there.
And another.
Do you really want to make
And another.
As cute as he went to the fence. I usually try to make him be outside before we come inside to make a mess. And as he came to the fence, two of them came to the fence. It was cute. I got a picture of him.
Sven loves little dogs. He always has. So when he sees a little dog or a kid in pink clothing, he automatically will come over to him.
And another.
See if we collect or not. He might be just a little young here still.
So it was probably
So that's the case that I want to try again in a couple of months.
probably easier when he was in heat, when she was in heat, because it made him more interested.
Definitely.
And another.
Most of them will just immediately collect,
Okay.
and then he's got an erection.
Today is not the day for Rusty's luck.
Collection at all. So generally, in case-
DocBott will try again in a few months when Rusty is a little bit older.
Okay.
are you doing, Doc? Huh? Sorry. Something that I very frequently do here. And to collect semen in dogs, you actually have to just grab the penis and you actually do a manual stimulation. Try not to let your face go red when you do that. It's kind of funny. Some clients will just stand there awkwardly while you're doing it, and others are very interested. When there's kids in the room, it's always an interesting experience. They're receiving education one way or the other. But you grab just above what's called the glans penis, and you actually grasp the penis, and it actually will, an erection will immediately form. Ejaculation occurs in 3 different fractions in dogs. The very first fraction is really not very sperm rich. It's kind of a pre-ejaculate. The second fraction is actually where the majority of the sperm cells are. And then there's a third fraction. Generally, the third fraction starts when what the dog does is it actually turns around. So they'll lift their leg and turn backwards, and so that the penis will go back, caudally, and then the 2 dogs that are breeding will be rear end to rear end. And that's generally when that third fraction occurs. So that second fraction is really what I focus on trying to collect the most of. But here we do a variety of collections, semen analysis, semen freezing. We ship semen all over the world. That's what's really nice about artificial insemination and these reproductive technologies is that we can get semen from anywhere and within 1 or 2 days have it shipped and delivered and ready to breed. So it really enhances the genetic pool you can pull from. So on him, we did not get a successful collection. It's hard to know why. First off, this is the first time we've collected him. We're at a strange place. Maybe I don't have the magic touch. Maybe, he doesn't collect well that way. We'll just have to see. I always recommend retrying. He's only 1 year old, so he's still pretty young. I wouldn't worry. About 6 more months is really when we should be doing these breeding soundness evaluations. 18 months to 2 years of age. So we'll just try again down the road. It doesn't necessarily mean anything's wrong. Having a dog in heat auction is also very stimulating to the dog. It's hard for him to be aroused when it's just a veterinarian standing there grabbing his penis.
After the decision to sedate is made, DocBott goes over the different medicines with the resident.
Yeah, so we've got a full seed pod. I mean, it's stem all the way up, and it's just wrapped completely in the hair, and it's right next to the what we call the medial canthus, which is the middle corner of the eye. And so at this point, this was the best choice to come get her sedated, and we're going to do our best to do this as gentle as possible. Staying as far away from the eye as we can, but at the end of this we'll end up checking on the eye and make sure the eye's okay and it hasn't been scratched or damaged. But this is really tight in there.
I'm involved with several animal rescue organizations. One of them is called Utah Valley Animal Rescue, and it is operated by Heather Hone here in Lakeshore, Utah. And she brings in a variety of pets, dogs and cats, and a lot of them are in really, really rough shape when we see them. Yesterday she brought in a small kitten that was 2 pounds that had a diaphragmatic hernia, which is actually a hole inside the diaphragm. A hernia, and part of its liver was up in its chest cavity. So we had to perform a pretty complicated surgery where we actually had to open up the entire abdomen. When we were inside, I could actually watch the heartbeat and the lungs inflate and deflate as I fixed the diaphragm. And the kitten, I just got off the phone with her, is doing very well in recovering exceptionally quickly after this major procedure. She seems exactly just like a normal kitten today, which really makes me happy to hear.
She had her eye removed.
Yeah, so she's getting her stitches out today.
Go get her stitches out.
In the lobby, a beautiful cat is waiting to have stitches removed after having its eye removed from an injury a couple of weeks ago.
It's amazing when you take care of them, they
Yeah.
still live.
I know.
Okay, so Simba's a kitty cat that came in with actually a ruptured globe, a ruptured left eye, and we had to remove Simba's eye. Ironically, this day we had 2 pets present within 15 minutes of each other with a left eye injury that both required emergency removal of that eye. One of those days you never forget. So we're just going to recheck right now, make sure that Simba's healing really well. When we remove the eye, we close the skin over the top of the eye itself, and so there's just essentially a little scar there that we have sutures in, and it just kind of heals closed. they do make prostheses and things like that they sometimes will put inside. There's an ophthalmologist up in Salt Lake City that routinely does this, but here in general practice we usually just remove it without putting anything in, and they recover really, really well.
Kudos to the groomer for passing this along, because this is a hard spot to work on any animal, let alone these little anxious dogs.
There you go.
There you go.
There we go.
Wow,
Hey,
nice work. Where'd you
Like
come
that.
from? You're a pro at this. Good work. Just gonna look in her ears, make sure we don't have anything going down that way. Would you mind grabbing another scope?
Absolutely.
We'll look at her ears. Youch, girl. Did you notice them yesterday?
She said today, but it was this morning when I went out to go to the bathroom.
Oh, that's right. Yep, that's what she said.
Other stuff stuck in the fur. Oh, yes. On the fur. Breakfast, you know. Yes. Breakfast.
Back in the OR, the team is finishing up the burr removal on Bella using a dye and special light to look for possible eye injuries after finding sores near her eyes.
So yesterday, I'm doing a considerable amount of work with the South Utah Valley Animal Shelter, and I had a call yesterday that they had a goat that they found wandering on University Avenue in Provo, and with a very, very full, huge mammary gland. So I went to the animal shelter yesterday and milked her, and she has a very severe case of mastitis, so we gave her some antibiotics and actually did an intramammary mastitis treatment. Hopefully she's on the road to recovery. Just a tiny, tiny little goat.
Penelope's only problem is that she can't stop eating.
She likes her food much?
Yeah.
How many
Penelope and her mom wait patiently for DocBott as he reads the results for another patient.
Sure she didn't pick up any more as we're carrying her out, right?
Yeah.
Get her a fresh towel.
Bella is ready for recovery for an hour or two when she can go home with her mom.
Pray. Look, pray.
The patients just keep coming. DocBott enjoys the revolving door pace of a busy animal hospital and jumping in while the assistants and techs help other people. Another furry friend undergoes a serious surgery.
Well, today we had to perform a surgery on a cat named Nellie, and Nellie presented a few days ago with blood in her urine. Anytime a cat has blood in their urine, or if they're straining to urinate or vocalizing when they're urinating, it can be an emergency, and veterinary attention is always needed in those cases. So they brought Nellie in, and I did a quick exam. I palpated the bladder, and actually with my fingers through the abdominal wall I could feel stones inside the bladder. I took a urine sample and looked at the crystals, and the type of crystals that I could see are called struvite. So I recommended that we perform surgery as soon as possible, but we needed to begin antibiotics that day, and the soonest we could do the surgery was this morning. So this morning we took an x-ray to make sure that we knew exactly how many stones were inside the bladder on Nellie, and then we went in surgically and removed those stones. These stones were quite jagged, and so they were actually just tearing the sides of the bladder wall up, and that's what was causing all of the bleeding. The good thing about this condition in cats is that we have diets that are used to treat these stones and to prevent these stones. So the diets, one will dissolve the struvite crystals that are in the bladder, and the diet 2 will also prevent the formation of more crystals. So there's 3 different types of diets, main diets that we have on the market. The brand that I like is made by Purina. It's called UR.
Alright, where do you want me to stand for this?
You can be just straight opposite of me.
I'm ready.
What kind of stones do you think we have here?
Let's see. So I'm trying to remember the switch, because they used to have struvites in cats, and then they switched the diet. So now it's calcium oxalates they're most common.
But ironically, on this cat, it's still a
It's still struvite.
Yeah.
Uh,
This cat's had several surgeries, so it's going to be a little bit of a mess getting through this, unfortunately.
This is the cat we saw the struvite crystals in the urine last week. Is that a different one?
I don't remember if you were here. This might have been on Saturday. I palpated the bladder and I could feel 2 stones. They were inside the marbles.
No, I wasn't here Saturday.
I would have definitely had you palpate just over here. So right here we've exteriorized the bladder, and we have 2 very large stones inside the bladder. We could see those on the x-rays. Now there's been a previous surgery performed on this cat, and there's what are called adhesions, which is scarring right here, where part of the abdominal contents are actually adhered to the bladder on this side. So where I would normally make my incision, I cannot make that because of the adhesions. So I'm going to make an incision over here on this side of the bladder. Get that 3 on it, the taper. So I just throw in a quick stay suture right here. Draw it even when I do this. Just to make sure we're... Now we're gonna, we started antibiotics on this cat to try to minimize contamination and infection. Just gonna keep that out for us, okay? So now we're gonna have to do our best to keep that from. Started antibiotics on this cat to try to minimize contamination and infection. No matter what, you're going to have some contamination. cat on a prescription food will definitely prevent more stones from forming. Nope, we're not going to need to take one today. If we were a male, we probably would. Right now we're going to test this incisional integrity right now. We're going to fill that hole. Just going to inject some saline right inside of this bladder. Some fluid. This is called lactated ringers. Now we put some fluid in here. We're going to just gently push. Going to mimic the filling of the bladder inside and make sure that there isn't any leakage. What do you think, Bobby? You see any leakage here?
That looks good.
Okay.
The surgery was very successful. We went in, removed the stones, and closed up the bladder. The bladder heals very quickly, so it was a successful surgery, in my opinion. We were able to flush out the abdomen, and we're going to just keep her on some pain medication for about a week, but she should be back to normal within just a couple of days. And of course, we're going to start her on this prescription food. Now with Nellie, she's actually had this surgery a couple of times before, and the owner claims that the concept of managing this with diet was never brought up. So that's kind of sad for Nellie, because this is the third time she's went through this surgery. The first 2 times I didn't perform the surgery. But if we could have prevented the last 2 surgeries for her, that would have been a lot better than having to go in 3 times into her abdomen. But now she's going to be on this food, and it should prevent everything from happening again. We are going to send the stones in just to make sure that they are exactly what we assumed.